Okay, now good. Okay.
Okay.
You start your session now. Yeah.
Thank you, Sarani sir. Thank you, Hindi team. Now we are moving to English session. Today is our 1878th day of continuous webinar. Thank you all the participants for joining with us. Now we'll start. As usual, we'll have a silent prayer. Good evening and welcome everyone. Today is our 1878th day of continuous webinar. Thank you all the participants and thank you all the faculties, those who are sharing your knowledge here. And today's our guest is Dr. V.K. Karunakar. He's MD in Homeopathy and medical officer. He's working as a medical officer in Nellore and former assistant professor of Government Homeopathic Medical College, Kadapa, and senior consultant in Karunya Homeopathic Homeocare, Kadapa, and Vinayaga Homeo Wave, Hyderabad, and worked as a consultant in Yashodhara Homeo Clinic, Nellore. He has more than 14 years of experience, and I am welcoming Dr. Karunakar for our, to deliver your session. You are welcome, Doctor. Please. Sir, please unmute yourself. Oh, thank you. Okay. Okay, you can start now.
My voice is audible, ma'am?
Yeah, sure.
So today topic is good evening to all whoever present in the session and also whoever constantly sharing their knowledge in this continuous session for a longer period. It's a very good effort to promote homeopathy. Not only promoting homeopathy, we are enhancing our knowledge through which. So the knowledge is never ended to learning process. Learning is the key to acquire a knowledge and show efforts and efficacy in the field of homeopathic medicine. So I already presented 2 or 3 classes in regarding homeopathy and related cures. Today also I would like to discuss about on the topic is cure. So why I have taken the cure? My topic is analysis and understanding of homeopathic cure and its clinical importance. So in the present scenario, everybody, even a few people are used homeopathy or whoever came from another system of medicines, the constantly struggling, they are not completely recovered. Even many patients are complaining, I used therapeutics, but I am not well-being. Certain manifestations are disappear, but I am not recovered well. So that's why, what is the reason for not gaining completely their energy level? That means physical, mind, and spiritual levels, they are not gaining comfortability in that. So that's why most of the timings, most of the people are used the term cure unanimously without knowing the meaning. So the cure definition is completely changed in the present scenario. So the cure means just relieving of the symptoms, are free from the symptoms. So is it real cures or not? So we have to analyze. So that's why my topic I have quoted, designated analysis and understanding of homeopathic cures. Why? What is the need to analyze? What is the need to understanding, especially homeopathic cures and its clinical significance or importance? So clinically, how far are there? Everybody asks, my disease was cured or not? My disease is how many days it has taken for curing the disease, all other things. So as a homeopathic man, we were using this technique analysis in case processing. After completion of the case taking, we are analyzing the case. And what is mean by analysis? So there is a division as per case processing norms. There is a division of the complexity into the small components for understanding better. So as normal definition of analysis is also to break down the complexity into small particles to understanding the process, to get the better knowledge, to get the better understanding or knowledge. So what is mean by understanding? To acquire, to grasp the things. So to acquire the knowledge, to grasp the, so that simple meaning of that understanding is comprehensiveness. Our presentation in comprehensiveness or whatever the thing work we should done, it is a comprehensive, means easily explainable to that. So is it homeopathic curative process is easily explainable? In our session also, we have to listen many a times. Many authors or many presenters are presented sharing their knowledge. So in a different views. After listening that one, we have to, our mind thought there are so many doubts has raised in our mind. So recently we have to, so this remedy, everyone shows the efficacy of homeopathy in front. So I have prescribed taking the case. It's a very difficult case, and I have given a remedy, and completely cure takes place, and completely free from all of them. Means there is no failures in homeopathy. So no one has presented the failures in front of us. Is it real? Everyone has success rate, 100 success rate. Everyone doesn't have any failures. We have to analyze. That is the meaning of analyze. What is the percentage of cure in homeopathy? Cure cases in homeopathy. So why they are cured? Why not they are cured? So homeopathy, the discovery of homeopathy, the main aim of the discovery of homeopathy is to cure. So homeopathy is a new therapeutic in which there is a curing of the diseases. So by treating the disease conditions or diseased individual according to the similar principle, that means the drugs which are used in homeopathically, they are having ability to produce the similar manifestations. Whenever similar manifestations are produced, or whatever, whenever you have treated the case according to the similarity or similar principle, it is the only principle to cure the disease. Many authors have described it. From the Hippocrates to the present scenario, everyone has raised or meditated that statement. So in which way the diseases are cured means only homeopathic way. That means similia similibus principle. Here is also many aspects are there. Without understanding the aspects, that means the case taking process or whatever the modus operandi, especially the modus operandi as stated in the 29th aphorism. So with the many people, our upcoming generations are asked, or even patients are raised their questions, how my disease was curable. So explain, please explain me. I have a disc prolapse, I have a tonsils, I have a heart attack, heart problem, there may be enlarged or some other thing. I used. So is it possibility to reduce completely my sugar levels or hypertension or thyroid, all other things? Is it continuation of treatment for longer time as allopathic or other modes of treatment like that? So everyone has their own pathways to answer these questions. As similarly, our homeopathic people also have stated that one, either it may be curable or it may not be curable. So if it is a curable, how many times? So we are not we are giving some amount of assuring to our patients all other things. So that's why without understanding the real cures, what Hahnemann was proposed, the discovery of homeopathy, his main aim for to obtain a real cures for the patient. We are without understanding, it's a very, very difficult to performing cures. So even
Doctor?
in the nature, ma'am.
Are you moving the slides?
Yeah, okay, ma'am.
Okay.
Yeah.
I thought,
So
okay.
yeah. So I have discussed my topic in that one. So in the introduction part means that is thing. So without understanding the modus operandi of homeopathic cures, so either which stage that the curative process at which level we are able to understand ourselves. So it makes very easy pathway or easy forward stepping in further. Either there is no possibility of cure, we have clearly explained to the patient this is the only thing. So Hahnemann or our homeopathic literature clearly stated that one, there is no possibility of cure, or what is the method of treatment in incurable cases. So all other systems they are performing only palliative process. The body itself has maintained or making its own cures with the aid of other medical professions, except in homeopathy. In homeopathy, there is a possibility of palliation and cure. Both are possible in homeopathy. So the palliation means when it is possible. So in other, the law is same. Here, either it may be a palliative case or it may be a curable case. So the similia similibus principle is the only thing. So here, very, very students are some homeopathic people are misunderstanding the concept. In a case of palliation, it is not the principle of homeopathy or what we are treated that one. So why we are not getting proper cures in homeopathy? But the aim of the proving or discovery of homeopathy is to cure the diseases. This is the only I concentrate in that one. So here already define already analysis. Here no two individuals are alike. No two individual cures are alike. So that means so the cure is not applicable to equal one person. In one particular person, in two disease conditions, they are not similar. The cure takes place, but not similar in the aspect of duration, in the aspect of free from that one, or the remedial requirement for curing of the disease. Even it based on the vital reaction of the body to the our medicinal agent, and similarly the intensity of the disease or how they are reacted, how are they are showing the reactions to the our medicinal stimuli. So Hahnemann is himself clearly stated that one case is not ended with one single remedy or one similar remedy. There may be a requirement of a series of remedies for curing the disease. If people, after seeing some people, I have attended some seminars, so they want to show only one dose for longer period, so years together. I have raised this question many times. Sir, how it is possible? There is no possibility of developing certain other disease conditions middle of that one. What you can do? What is your approach middle of that? Suppose hypertension is there. You are treating one particular remedy prescribed to the patient. Yes, very good result is there. Maintenance of hypertension, blood pressure levels for longer period within normal limits. So either patient has developed either cold or bronchitis or some other acute conditions middle of that, or sometimes the acute exacerbations of that chronic condition are like that. What is the approach? So many are years together, how they are stick on to the our homeopathic principle is just a very surprising thing to us. So like that. So they are explaining their own way, some other things. Some people are not giving any other remedy. We are stick on to that one. Some people are we are giving middle of that some other acute remedies. Some people are answering some other remedies. We are happy to that one. So if you are inquiring the patients also, not only stick on to the doctor's concept, and sometimes we have to inquire the patient concept also. The patient is very intelligent. They are used almost all the varieties of treatment. He said every designation to given yes, very good result is there are like that. So that's why Hahnemann clearly stated that one don't study the disease, you have to study the sick individual. The sick individual is also studied by different aspects are explained in our homeopathic literature. That means the studying method is called as a science. So he have systematically studied. So we are sometimes one we are seeing that means in the present scenario we are missing that scientific methodology in recording of the cases or presentation of the cases. So that's why we are little bit back compared with all other medical professions. So not enjoying the fruits of real fruits of our homeopathy. It's my own perception. Don't make it. Don't. I'm not criticizing anyone, or I'm not making a thing. So why? Because even though reality is there, we are not enjoying that real fruits because of somewhere some lacuna is there. Maybe I observed. So on this base, why? Because so if people are showing their beautiful picture in front of that one, so they are said some people are believing the miasmatic concept, some people are positive, different types of prescriptions we are observing in the different types of people presenting in their own experiences and other things. Some people are stick on to the causes, some people are stick on to the mind, some people are stick on to the, so everybody said is our concept is holistic concept. So in the holistic concept is also, is it availability of all the manifestations? Hahnemann clearly stated that one-sided diseases are there, fully developed diseases are there, and different plans were explained. But here, all whatever the content is, our aim is to cure the disease. Their planning methods are so. Everyone, if you are raising your question, what is simple, beautiful answer we are getting from is individualization. Individualization. Everyone is individualized. So maybe my observation is so. Yes, Hahnemann has our homeopathic science is a individualistic concept or individualistic science, not the individual science. Individualistic is different compared with individual. So everyone, whatever the approach is, ultimate we are meeting the aim of the cure like that. So that's why the scientifically we are very stronger But coming to the practicality, that means artistic technique, so we are lacking because of some people are very good. We are thorough with mathematics, thorough with organon of medicine, thorough with the clinical subject, thorough with. But where we have to fail to correlate each and another one, we are fails to little bit or compare with the back when we are using this pharmacology and clinical subjects like anatomy, physiology, pathology. That means pathology. So pathology, pharmacology in both aspects. The pathology stated that the signs and symptoms. The pharmacology means how the drugs are altering. So your homeopathic principle stated that one, two things. So that's why a few people are there showing their beautiful presentations in that one. The outcome is very good, beautiful, but little bit confusion is there middle of that one. In which way, in what way we are reaching that place all. So that's why scientifically it is our in front of four walls of the walls of the room, our homeopathic science is a good. When coming to the public space, we are not reaching up to the goals. What are the goals designated by our master Hahnemann like that? So that's why scientifically we are strong, but little bit we are back in the artistic manner. Artistic manner means practical. Art is a practical. Science is a theory and art is a practical. Modern medicine and homeopathic medicines. If you are observing from the ancient day to the present scenario, the modern medicine means other systems of medicine and only homeopathic medicine. So here there are different types of specialists are there. They are concentrated on that one. So what is the in homeopathy? If one physician is equal to all varieties of specialists, but the public is not in a position to receive these concepts also. Without that, we are educating, we are able to treat all the cases, we are able to acquire a knowledge. So we are able to treat or acquiring knowledge to cure the diseases in all aspects, in organic, equal to all varieties of organic things. So little bit we are promoting the homeopathy in maybe we are come backward. So especially in a case of in a ophthalmic aspect, certain aspects of their ophthalmic diseases. If we read our Metromedica, there is a blindness rubric is there, repertory. Certain drugs were used for blindness or rubrics are there, blindness, color blindness are there. So if you see or read those rubrics, is it possible to cure? We are bring back to the blindness into a able to powerful vision. So little bit different people they have their own explanations, but ultimate in what context Hahnemann was clearly proposed or our stalwarts are treated those cases. If you see, if you are understanding the process in which aspects strangulated hernia or some other rubrics were there where they are, when we see those words in the repertory or Metromedica, we have a doubt. Is it possible? There is no doubt at all. Try to understand how far they are reaching, how they are treating, how they are understanding the curative process. We are also reach that stage, then we are really promoting our homeopathic principle and other things. So here, ultimate we make Hahnemann clearly stated unity in diversity. So we are all making as unity, act like a unit. So in treating the diseases, but we have a different approaches, different things. So different principles, we have different explanations we have to give our things one. So this is called as an analysis. So we are analyzing our curative process. How many cures we are getting in every day. As a homeopathic physician, it's our responsibility. In this month, how many cases you have treated, what kind of cases you have treated, how many cases are cured, what are the parameters. So let I explain what is the meaning of cure, other thing. Without analyzing that mean, why we are failure in that certain aspects. So we are not analyzing, we are not review our knowledge, we are not developing enthusiasm or interest towards the reading or to correct our that thing. So that's why when you have analyzed your cases, when you have analyzed your technique of treating the sick individual in a case of failures and success, so you have to maintain that balance always. So that is a scientific process of analysis. This analysis technique is used in the data collection or statistical point of view. Everyone requires. Our homeopathic science is a evidence-based medicine. So how we can decide? How we can decide it is evidence-based medicine means through statistics, through basic only. So everyone has shown their own statistical data for their success rate. So like that one. In the case of this analysis is also quantitative and qualitative case. So quantitative means number of how many number of cases are cured, how many number of cases are palliated, so how many number of cases are failure. So what are the reasons for success? What are the reasons for palliation? What are the reasons for failures? We have to analyze. Then we find out the reason. So the reason is really acceptable thing to correct it or to overcome it. So to get further success in your that thing. So similarly, qualitative means. So what is meant by qualitative here? We are giving more importance to the qualitative. So qualitative means we are also given a patient came to us and complaining of tonsillitis pain is there. We are prescribing belladonna. So why? Because there is enlargement, redness, or different approaches are there. Different people they have given different kinds of remedies to according to the need. But few people are improved a very lot. Few people are not getting result. Few people are stand still. So in these different types of reactions, we have to observe why the belladonna works in certain cases, why belladonna doesn't work in certain cases. And here one more point is also there. So the belladonna, even you are not prescribing in a right dose, that means potency or number of doses we are, a few people are giving single dose, few people are giving 3-4 doses, few people are giving dilution, few people are giving in the mother teacher form, few people are administered in higher potency 1M, 10M. So these are different approaches. Which one is right? We are unable without understanding their background motto or what is the background phenomena to prescribe that potency or dose for the individual. This is the understanding. This is need for analyzing and understanding technique to homeopathy. If you are not learning this technique, blindly following, so the technique belladonna has given, you are giving, doesn't, you are not getting cure. So in spite of not curing the disease, you are creating some unnecessary nuisance in the case, and other complications are also risen. In the present scenario also, many times I have received, I used homeopathy, sir, ultimately we are entered into the surgery, the doctor has scolded me, why you are stick on to till that time. In this stage, we are unable to take it that many cases were rejected by allopathic people or other medical mans. So because of stick on to homeopathy till that time. So the stick on is not the fault of a patient. So the patient stick on to the system of medicine, give boost up to us to check our medical, our drug actions many times. So the patient confidence create some pathway to observe our drug actions. This is my personal opinion. Why? Because without giving the chance, the patient doesn't give a chance to you. You are unable to check your medicinal agents, especially in that one. Recently, I have received on phone call one homeopathic doctor. So he stated that one. So my father was suffering the severe constipation. He was allopathic people are diagnosed it is a paralytic ileus. So he is unable to pass passed stools. So they are given almost all varieties of treatment, all other things, but constantly bloating is there, unable to pass. My father was suffering is like that. Okay, ma'am, have you tried anything all other than I don't given any medicine because of it is a very serious state is there. He was admitted in allopathic hospital in ICU unit. They were treating. I am unable to give any other remedy. Yes, okay, ma'am. Don't worry about along with allopathic medicine. You have to give 1 drop of dilution, opium 200 dilution to your father. So you have to admit, not admit, there is no possibility of oral administration. Majority of time we are there in the allopathic ma'am, because constant perception of visualization of allopathic people, sisters or compounders, they are not allowing. Yes, the madam has administered a single drop of opium 200. So they tried more than all types of laxatives for 3-4 days, but he is unable to pass. Even enemas are also given to that patient, unable to pass the stool. But our opium works very well. After administration within 3 hours, so he is able to pass a little bit hard round balls like stools. So after passing the stool, patient free from all these things. Even though he had that problem, he was so expressing some amount of comfortability. So that was the act. Is it possible in all cases of such a thing? May not be possible. So that's why you have to understand in which case we are getting quicker result, in which case it takes time, but the result is same. But there is a need to understand. So in what we are getting that result, in what way the patient is expressed. So that's why here here means a qualitative means a patient was having all symptoms are disappear, but is not getting energy level to perform daily activities. So that's why my symptoms are disappear. I have free from all these things, but I don't have appetite or some other things as early as possible. That means, say, if a drug is working, the symptom free, but not gaining completely or fully recovery. So that is called as, so it is called as a qualitative analysis. Even after going to patients went to a surgery, after surgery they have something, some problems, some lacunas in their body. So tonsillectomy, they have started some lump in the throat or constantly irritating in that one, or even hemorrhoidectomy. After hemorrhoid, they have a constant pain in that anal region. So today you have to observe whoever underwent a surgical procedure also, they have to develop certain manifestations. So they are having persistent symptomatology. So that's why even we are using our homeopathic medicines, so they are free from symptoms, but they have some lacuna, not completely gaining their energy in the physical, mental, and spiritual aspect. So that means the quality of life is not improved. Quality of life is not improved. So that's why the quality of life is more important. So that is there is a need to analyze. This is called as a qualitative analysis. So not only a success, how many cases are cured, that means a quantitative analysis. The qualitative analysis, how many people are having better life or good life or healthy, happy life after treatment, after taking treatment with us or in front of you in your clinic. This is more important. So when you are, next one is understanding. What is meant by understanding? The grasp the process. So what means easy to understand? Even it is very important in our case taking process. Also, understanding is one under the component of mental generals. So he is able to understand the each and everything or not. So it is a very important in homeopathic physician aspect to understand the patient, to understand the disease. Both are important. So at what level is there? What are the normal reactions? What are the abnormal reactions produced by altered vital morbid phenomena? So that's why Hahnemann clearly stated that our therapeutics, a true therapeutics, a true scientist, a true physician has always to understanding the two phenomena. Why? Because our homeopathic law connects the two phenomena in a clinical aspect. One is clinical disease aspect, another one is clinical drug action, clinical drug. So here disease phenomena and drug phenomena, always it happening. It is visible, it is perceptible. Disease means a perceptible to you, always there symptomatology or other things. So that's why without acquiring the disease knowledge, without acquiring the knowledge of the drugs, without acquiring how they are applicable, when it apply, when it apply, how it apply, without knowing that one in a comprehensive manner. It is a comprehensive. When you are a comprehensive, so very clearly stated in the second aphorism or 70th aphorism, many aphorism, comprehensive. Homeopathy's meaning is comprehensive. The comprehensive means when you are more thorough with disease and drugs, very easily treat, very easily tackle with them. So that's why, first of all, you have to acquire a knowledge of the disease, acquire a knowledge of the medicine or drug to know how it applies. Different approaches are there. Either causative prescription is there, mind prescription is there, physical prescription is there, pathological prescription. Different prescriptive methods are there. So which method you have to adapt it. Either symptomatic treatment is there, followed by miasmatic treatment, constitutional treatment. Different approaches are adopted by, or some people are habituated. It may be division into animal or plant kingdom or animal kingdom or some other things, or when the patient or disease has fallen under which category, later on he has analyzed, coming to the ultimate single point out remedy. So that is the thing. So when you have thorough understanding about one particular individual, the mingle with one, or that means thorough understanding towards the system of medicine, you are able to accept everything. Either failure or success rate, both are equally feel. So when you feel it is equally, you are always in the balanced state. Balance is very, very important. So that express your comprehensiveness towards the principle, towards your treatment. So that is ultimate your it creates some sort of easy payments to reach our goals. So the homeopathic aspects are, the homeopathy is a method of curing the suffering of a person by the administration of drugs which have been experimentally proved to possess a power of producing similar sufferings in a healthy human being. So I clearly stated that one. As per this statement, so there is no failures in homeopathy. There was no chance of failures. Why? Because our drugs are proved experimentally. When you are giving to the patient, it acts like an antigen. When antigen act in the body, automatically antibodies are synthesized in that. They are always fighting with. So that's why many times hormone was used. Our homeopathic remedies are not only curative, preventive aspects are there. So the same remedy have used for a curative aspect and preventive aspect. We know if the instructions are eligibility criteria for using, it is used for preventive aspect, it is used for curative aspect. So when we decide that it is a curative remedy or it is a preventive remedy. So, but definitely the remedy must show a different type of action. Even at the time of Hahnemann, only 99 remedies are there. So he was tackling, handling many cases with those remedies only. But now enlarging whose Metromedica, that means nearly 5,500 drugs were there. So everyone used their own remedies. Partially proven remedies are there, fully proven remedies are there. Even nowadays, every homeopathic man attracted towards habituated the tauopathic drugs. So the pharmaceutical companies has also catch hold the minds of the homeopathic physicians. They have tried the tauopathic drugs always, or isopathic preparation or tauopathic preparation. So very easy to prescribe to the individual. Even creatine drops are there, urine drops, urea drops are there. So whatever the term, clinical term we have used. So on the proportionately, the name of the drops are available in the market, which are prepared by CURES. So it is a very biggest thing is our homeopathy is contradicts the combination and other things. So we don't know how they are proving real or not. Our drugs are whatever present in the Metromedica, they are singly proven that one. These combinated forms are proved. What is the efficacy? What is the clean? In allopathic, if you go allopathic methodology, the medical record shows these are the cases I have taken. This is the principle. This is the chemical content given to that one. These are the cases are responded. These are the cases are failure. This is so they are graphical presentation explained before releasing that one. Our homeopathic field, such a type of manifestation, yes, this combination is proved. Clinical study was conducted. So many groups of people or number of people are selected and other thing, but not possible. So that's why. But we are attracted to that one. We are using that one. Definitely, patient gets some amount of result. So we are not bothered about why, because patient get relief. We are getting some amount of benefit, fame and name, or money, all other things from the patient. So that's enough. But this is not our real responsibility toward that one. So for a period of time, it is a good. But after that one, patient is not a responding to that one. We are making so many complex conditions by our dissimilar prescriptions to the patient. So that's why what happening, even used homeopathy, now in the present scenario, everybody comes towards homeopathy is also like allopathy. So use and continues for longer period, even using certain things are relieved, certain things are not. But through which we are not fulfilling this definition. Why? Because so homeopathy is. So as per homeopathic aspect, the sick man was studied. So different aspects. What is that one? Etiological point of view, diagnostic point of view, prognostic point of view, therapeutic point of view. So why I have taken that one? If you know this, these are the aspects of studying of sick man. So you know through which so the similar the curative takes place. Cure takes place is also when we have decided curate. So the etiological, which one is the cause for that one disease? After treating the individual, even patient exposure to that one, you won't have any effect in the presence of those etiological factors. That means the body has developed a resistance towards that etiological factors or adverse factor. He feels comfortability. Earlier he was disharmony or discomfort. So that means so free from that one. That is the most important one. Similarly, the diagnosis, we are giving some labeling. Either it may be a case of rheumatoid arthritis, it may be osteoarthritis or some other thing. So after treating that one, that label is also removed from their body. So free from that label also, then only we decide as cure. Prognostic aspect, yes, he is free from prognostic means always good or bad maybe. So always good prognostic measures are expected from homeopathic treatment. So one quotation is also there. So by using any other medication, there is a possibility of good and bad reaction. But by using homeopathy, always there is a good effect. Always there is a good effect. Why? Because so in all other medical professions, as per my experience, so all other medical professions, you are using drug one particular condition, it has been removed or may not be removed, no problem at all. So stick on to that. But you are prescribed a homeopathic remedy for one particular condition. Suppose you are giving a remedy to the migraine, the patient has heart problem. The prescribed drug has showing similarity towards the heart manifestations, heart pathology. So the heart pathology bring back into the normalcy. So that's why by using homeopathy, we are getting always the good effect. So that's why you confidently believing that homeopathy, when you are using the weapons, that means the drugs, according to the principle, you are always getting the good effect only. So that's why the prognostic value is always good in homeopathic point of view. Last one is therapeutic. The therapeutic means so the complete restoration or complete bring back or well-being in the physical, spiritual, mind aspect or energetic level, structural level, these are all then we called or considered as a cure only. The scope of homeopathy comprises two sets of phenomena, clinical disease phenomena and clinical action phenomena. I already explained this one. So three factors which determine or alter healthy conditions of a man. So what are they? Number one is hereditary strength. Second one is the intensity of morbid stimuli, the degree of interference by treatment. So this is also the hereditary. So many diseases also resulting two conditions, whatever they are acquired hereditary. So each and every disease have acquiring hereditary. They are immediately developed after birth or during the life they are developing is quite different, but we are acquiring that one. Another one is during acquired, whenever we are exposed to environment, different environmental conditions, they are called developmental factors. So this hereditary without changing, when you patient has hereditary disorder, we are treating that one to remove, to strengthening of that positive hereditary. That means if you are reading literature so strongly, homeopathy, when you are using homeopathic drugs during pregnancy period, it has the ability to stop the development of the constitutional morbid susceptibility from the generation to generation. It has been stopped, arrested by the antisoric remedy which was prescribed during pregnancy. It has practically observed. I have treated 100 cases in my experience. So compare with, I have conducted experiment. So one first pregnancy is allopathic mode and second pregnancy is homeopathic mode, like that few cases are purely homeopathic drugs are few cases. So what I have received the statement from the patient's mind or patient's mouth is, yes, whoever born under the homeopathic child, homeopathic care, they are more comfortable or better or little bit quite different in all aspects compared with allopathic mode. This is the statement given by whoever using. So that means they have stated that one. So earlier child has developed allergy, but this child hasn't developed allergy. Why? Because that constitutional tendencies, that hereditary factors can be modified by that only homeopathy has the ability or capacity to modify that hereditary strength. And the intensity of morbid stimuli. This is also many people are having a misunderstanding towards our homeopathic concept. By using our homeopathic drugs, the all medical system drugs or other modes of treatment doesn't work. It is a wrong. In my observation, what I have observed, even they are they are used for longer period, the allopathic or ayurvedic or some other drugs, the body has developed resistance. The body has developed resistance. So after using homeopathy, they have developed better positive action, which dose they have used earlier. That is the most important observation what I have made out or observing that one. So if, for example, a allergic rhinitis patient he has used citrazine or montelukast for longer period. So after a period of time, he is unable to get quick result. How much result he get earlier to the same tablet. But after using homeopathic treatment for a period of time, you have tried to use in certain circumstances, whenever the condition is more worsening, you have administered that same citizen or Montalica, you get better and a quick result to that drug. Why? Because our drug has modified that intensity of stimuli, morphic stimuli, the resistance power has developed that one. So that is another one is the degree of interference by treatment. So we have within our hands, we are using. So that's why many of our homeopathic people our students are feel it is a very, very difficult or it is a bad science. Why? Because never fix up the dose or never fix up. In all other medical professions, they have fixed dose, fixed other thing. But in homeopathy, we are not like that. And it is a fundamental principle. You should not use one potency for longer period, one remedy for longer period. So one potency, why? Because the person has developed resistance. For example, you are using CCC mother teacher in an early stage of diabetes. It gives a better result for 6 months or 1 year period. After that, so the same manifestations are there, but the patient won't get a good result. Sugar levels are not controlled by using cesium, all other things. Why? Because the body has developed resistance. You are used the cesium in 6 potency, the patient get better result. After a period of time, 30th potency, you have to increase. Or for a period of time, you have to use the middle of that. There is a need to removing the miasmatic factor or intercurrent remedy. You have to, without understanding the consequences or the using of remedies, either intercurrent remedies or constitutional remedies or miasmatic remedies, middle of that, or symptomatic treatment, middle of that, we are unable to reach our goal, or we are not enjoying the fruits of real cures. This is another. So what happening in the comparison in the curative aspect? So what are the differences between all other medical man and homeopathic medicine man? So everyone has will of the voice. It is a common. So will of the voice means there is a specific medicine for specific disease. There a diabetic medicine is there, or hypertensive medicine is there. Either whichever the medical profession have take on the earth, they have specific names for specific disease, but we don't have. We are also having the names. Most of our homeopathic people also tell us there is no name, there is no specifics for homeopathy. Yes, we are always meditating on the basis of diagnosis on the symptoms. We are having remedies for sick individual. So diagnosis is more important in modern medicine. Every homeopathic man stated that there is no importance of diagnosis. In my perception, diagnosis itself a group of symptoms. We are giving importance to the symptom. That means a totality. So disease diagnosis also having a group of symptoms or totality of symptoms, but little bit we are included some other manifestations or alterations of the individual along with this disease diagnostic symptom. So disease itself totality of symptoms. Without understanding this concept, it's a very difficult to them. And every modern medicine, the cure defined is disappearance of symptoms. Where tonsillitis is there, tonsillitis is disappearance of enlarged tonsils, also reducing the swelling. Swelling is they feel very happy. Disease has been cured. But in homeopathic point of view, simple disappearance of symptom is not a cure, restoration. So even many times I used a remedy for fever. Fever is reduced, but I am not gaining my energy level, unable to do work. So this is common thing we have to observe. That means they are not completely restored. So restoration means so in all the levels, either energetic level, structural level, all fever is reduced and energy level gained. They have developed good appetite, good energy, and have performed earlier works as usual. Then only we call as a restoration. Restoration is our aim. So it is only possible by our homeopathic drugs. It is so another always possible the palliation. The drugs are producing palliation in all other medical profession, except the body has during palliative period, the body has regained their energy and the cure has performed by their own vital force or body. But in homeopathy, there is a possibility of cure and palliation and recovery also. So cures are purely medical aided cures. So without affecting other things. So similarly, the studying aspects of other that means the disease and cure. So dynamic disharmony. Cure is a dynamic restoration. So here the disease is nothing but disturbance in the harmony, disharmony, or increasing entropy. Entropy means disorder. So that means distunement of. So if you are taking the health is a music, so there is a disturbance in the music is called as a disease. Cure means restore that music again by using your medicines or similar producing drug agents. That one. Here we are studying the cause. The disease, there are many causes are there. In the cure is also the resistance, developing resistance or removing of the cure. In this aspect, if you are observing ancient period, there were dogmatists are there. dogmatists, they are always find out the cause for the diseases. One cause, one disease, very good, no problem. One cause, a multiple. So multiple causes can produce one condition. So one cause can produce multiple conditions, or multiple causes can produce one condition, during which, without understanding which one is more important, which one is key for prescribing the remedy, we have to develop the resistance to causes. So in the curative aspect, we have to develop a resistance to causes by prescribing similar remedies. So here the disease means it constitutes the symptoms. The simple meaning of cure is removal of the symptoms. Removing of the cause, removing of the symptom is nothing but. So in the disease, there is acute diseases and chronic diseases are there as per nomenclature. Here the cure also, temporary cures and permanent cures are there. One at a time. So temporary cures means temporarily disappearance. Permanent means complete restoration of that one. So different types of cures were there. The true cures are there, false cures are there, symptomatic cures are there, miasmatic cures are. True cures means a complete restoration takes place without affecting, without reproducing, reappearing of the signs and symptoms. We bring back complete energy, spiritual, mind, physical, in all aspects, chemical aspect. That is called as a true cure. It may possible. Okay. So false cures means a temporary relieving of the symptoms. So without gaining original energy or that earlier state of condition, but simply relieving the symptoms is called as a false cures. So symptomatic cures by prescribing. So organospecific remedies are there. For example, gas trouble is there. We have to prescribe a Robina. Definitely symptomatic cure takes place. Hydrostasis has given to symptomatic. So single symptom remedies are available in our repertory. If you are prescribing those things, the symptom has disappeared. Or in one-sided disease cases, most of the things we have to observe the symptomatic cures. So these are called symptoms are free from that one. Next one is miasmatic cures. It is a very, very complicated topic, miasmatic cure. So every chronic disease is resulting because of miasm. Without miasms are the real causes for the disease. Without removing the real causes, that means by prescribing miasmatic remedy to the individual, without developing that resistance to the miasm, eradication of the miasm, we are not able to get the permanent cures or real cures. This is a statement given by. So most of the things we are blindly giving the remedies with. We don't want to give when we are giving miasmatic remedies. Which one is a miasmatic remedy? What are the things constitute the miasm? How we are understanding without understanding what are the indications of the miasm? When we have to prescribe the miasmatic remedy, what is meant by miasmatic cure? Very difficult to taste the real cures of homeopathy. So as per this one, observations. Earlier period, there is a dogmatism and empiricist and methodist and vitalists. In the present scenario also, what in my observation, so almost these four varieties of people were existing in present scenario also. So what is meant by dogmatists? Dogmatists are they are searching for cause. There is a cause is there, they are prescribing. Yes, homeopathy, they are believing. Yes, this remedy works. Homeopathy is good for certain diseases only. Homeopathy works in certain cases only, up to some extent only. These people are comes under the dogmatism group. They are only treating those cases. They are testing only those cases. Why you are not taken on some other cases, all other things, they are not explained properly. They don't bother about for explanation anything. So this one. So they try to remove the cause. They are giving a remedy for certain aspects and removing those elements only. The aim of the duty or aim or duty of those people of the empiricists. They have received certain people. Some people are giving cues. Yes, belladonna is a very good remedy for tonsillitis or inflammation conditions. They are only stick on to that one. They are not tried. Why not some other aspects of the belladonna works? What is the action of belladonna in some other aspect? They are not tried. They are not showing enthusiasm or practicality towards that one. So they are stick on to that one. Only and also most of the thing, even some key characteristics are available in the case, but they don't bother about in their past experience what belladonna works for tonsillitis. They have even tonsillitis indications suggest the phytolacca, but they never prescribe phytolacca for those individuals. They have tried only belladonna only for longer period. These group of people are there. Why? Because so they are believing strongly. They are stick on to that one. They are not having interest towards conducting or taken up a new away thing. Another one is Methodist. So some Methodic means they are routinely prescribing the remedies. Rheumatism is there, Rustax is there, not bother up. They are not using their, even though they have a good knowledge and they know very well what are the prescriptive method, all other things are well. Another one is whitelist. This is Vitalist means as per my knowledge. So whoever, as per Hahnemannian principles, observe each and every stage and get each and every reaction taken into that consideration and getting forward step is called as a vitalist. So as per in my experience, I have to show some cases. This is a this individual has diabetes, and for longer period he has developed some ulceration on the food. So for longer period, he tried allopathy, all other things they are suggested. Many times they are cut down also, but they are patient not healed his lesion for longer period. After using our homeopathic drugs, so I started miasmatically in this case because you don't have any manifestations except diabetes, high sugar levels are there, only ulceration is there, discharge is there. What are common phenomena is there? As per literature, Hahnemannian literature, when it is a chronic case, you don't have any manifestations, so say a clear characteristic. You have start with miasmatic remedy. Not only that, miasmatic remedy, sulfur is the opening remedy, opening batsman for all cases. So in the literature, Centrum Medica, they are mentioning certain remedies are opening remedies. And that sulfur, sorinum, palestilla, these are the opening remedies for that one. I started with the sulfur. So later on, he has developed some amount of discharge, all other things. So offensive discharge come, there is no development, granulation tissue, all other things. So later on, I prescribed the phosphorus. Why? Because the surface is very, there is no pus formation here, but only bloody surface is there, and patient is very mild or soft in character. So burning, he has developed burning. On that base, I have prescribed phosphorus along with calcareous sulfur 6x biochemic tissue salt for lung. So I used phosphorus many times. Later on, it comes under the not healing. Non-healing tendency is the characteristic of syphilitic or psychotic in nature. But if you see observing that indurated base is there, so that's why I used Tuja miasmatically after phosphorus. I used different potencies of phosphorus along with miasmatic remedy sulfur and Tuja. So the patient is developed very nicely healing that one. So you have seen before treatment and after treatment. So this is in my experience. So that is. Another one is a girl child aged about 22 years. She is a homeopathic student. She is studying homeopathy third year, but is developed multiple boils on her leg, multiple boils. So he was consulting some homeopathic senior physicians, all other things they tried, or because of her knowledge, Heparsal is a good remedy for pus tendency. She tried Heparsal and Merxal and Silesia also, or some other people stated that one Echinacea mother tincture, all she tried because of her knowledge. But later, after even after time is going on, she doesn't heal her boils. After 1 month period, she was consulting me. I asked my interrogation, what are the remedies you have to use? She stated that almost all the varieties of remedies. So I think why many remedies are taken. They are used sulfuries also because of miasmatic all other thing. So maybe fails to cure that one. So I re-analysis that case. Why that means I was showing the muscular area is there, multiple boils are there, maybe tuberculinum, sickle car, pyrosinum, these are all things are there. She was used pyrosinum is also why because. So what I can do? So I used many times. So the abuse of homeopathic remedies is there in one rubric in the repertory. Tuberculinum sepia is there. I used 1 dose of tuberculinum. After 3 days, I have prescribed to take Bellis perinus. So Bellis we are used the Bellis perinus is for rheumatism, spine, muscle or spine, all other thing. But in that one, if you go boric metromedica literature, boils are multiple boils are there, soreness and sensitive touch. The key characteristics are there. After Bellispar within 20 days, so this is the status. This was the status of this is a beautiful cure performance. Till now, she won't get any other things are there. So Bellispar in this and use tuberculinum as an intercurrent remedy or miasmatic remedy. So that one. Another important one. So this is also her sister. This is communicated with spreading of infection. So she is also used almost all the varieties like Merxal, Heparsal, all other things. But similar phenomenon, I used tuberculinum 1 dose for this lady patient. So later I suggested to take sickle car. Sickle car 30 potency 1 week. Next week 200 potency, later on 1M potency. I used three varieties of potencies. CURES used on the basis of already tried almost all the drugs, so that's why. So the boils are small, painful, discharge, discharge of blood with pus, maturing slowly. Small, they are started at small, and it takes time, 5 days or 6 days, and there is a formation of pollask united together like that. There is a ulcer. So see, after that, that means that is the key indications. Multiples, boils, small in size, and maturing slowly is the key characteristic. And if you are touching the affected part, so there was no information. So cold, the affected part is cold. So it is also a key characteristic of CURES. It is looking like a gangrenous, also gangrene like. So it is also more important. I prescribe CURES after I use the tuberculin as a starting dose later on. So within 45 days, you have to see how nicely recovered. Even little bit contamination or infection spreading into other finger is also that one. Another important one, myself, I have developed a style. I used only earlier the graphitis I used, but it fails. So Staphylococcus I tried, but I fails. But I repertories or just I used a reference. Repertory is a reference book, and right upper eyelid heaviness with headache. So Natramur is there, acid pass is there, Pulstilla is there, Staphylococcus is there. But I used because of a heaviness of that lid and painful and headache. So Natramur, how nicely recovered. It is my own case. I have developed this time. So this is another important one. So a this is a case of 1 year. Since 1 year or more than 1 year, he was
Doctor,
using
we have only 3
diarrhea.
minutes. Doctor,
Yeah,
we
ma'am.
have only 3 minutes more.
Yeah, I connect. So this is a diarrhea case. I used many homeopathic remedies were tried, allopathic treated. So maybe he had IBS, such a manifestations, they failed to diagnose. I used on the basis of phosphorus. I used phosphorus on the basis of diarrheic nature, loose stool and mild gentle character. So within 1 month period, he had passed daily 3 or 4, 5 stools. But within 1 month period, he completely stopped. He passed only 1 or 2 times. So he has developed energy, all other things earlier, whatever. So later on, we have to see. So this is a very important case. He has recovered. If you are later, we have to listen how much the face is very to observe that one. Observation is the key step for we know the curative process, all other things. So this is most important one. This is also another important case. So electric shock. So they have while rainy period he was touched the electric wire and he has developed weakness, all other things. Straight for allopathic man has prescribed some vitamin tablet and painkiller. He won't get the result. So electric ailments from electric shock and weakness and cramps. I have used phosphorus 200 every third hourly for 3 days. Definitely get more lot of recovery is there. You have to listen that one. This is another thing. So ultimate, I concluded my topic. Why we are not enjoying the real cures of that means we are sticking to the polypharmacy, multiple prescriptions, lack of confidence towards the principles, and overconfidence, and lacking of patience, and not accepting nature and ego. We are not accepting the success of others and failures of others. We are commenting always. So we are not enhancing our knowledge. We are not sharing that one, but not here. But what I generalized that one. So that's why we are not enjoying the real fruits of that one. So ultimately, if you want to enjoy the real fruits of homeopathy, so there is a success to CURES, application of principles, understanding of the laws, and smart and hard work, and acceptance. You are accepting failures and rectify your mistakes and enthusiastically and confidently how to step into all other things. Definitely you are succeeding, and every most you are learning. Learning is most important. So that's why I concluded analysis and understanding of
Sir?
homeopathic cures are most important for developing our homeopathy. Success is not a destiny. Success is a journey. Yes, you have to enjoy homeopathic success journey. And thank you for giving this opportunity to share my experiences
Thank
in
you.
this.
Thank you so much, Doctor. Thank you for sharing your knowledge and cases here. And I'm inviting Dr. Ram Parvesh sir for giving vote of thanks to Dr.
Thank you, Dr. Anjani. Time is a short and congratulations, Dr. Karunakar. Great presentation and case presentation is a very good. or angle of treatment according to homeopathic angle, mathematical angle, and pathological angle. Mathematical angle is a very important curative way of treatment. Tuberculosis, diathesis, psoric, psychotic, and syphilitic case presentation. Very nice. So very, very thanks, Dr. Karunakar, and king of anti-psoric remedy, sulfur. But queen of anti-psoric remedy, sorinum. King of antipsychotic remedy, thuda. Queen of antipsychotic remedy, medorinum. And king of antisyphilitic remedy, Merxol. Queen of antisyphilitic remedy, syphilinum. So very nice presentation and select the mathematic medicine. So thank you. Very, very thanks.
Thank you so much. Thank you, Dr.
Very,
Ramparvesha.
very thanks, whole team, behalf of IFPH. Very, very thanks again presentation. Thank you.
Thank you, Dr. Karunakaran, for your class. And now it is the time for the Malayalam session. I am inviting Dr. P. Shaila for moderating Malayalam session. You're welcome, Dr. Shaila. Please.